So for those who don't know me, my name is Dr Ishii. This is session 2 of our webinars in this webinar season. So I'm really, really excited. I'm actually particularly excited because I get to be the first to introduce you guys to our PicoSure Pro laser. This is a laser that I actually trained with when I was a fellow in San Diego, and I have been frankly begging our practice to get us this laser ever since. So I am thrilled to get to introduce this laser to you guys. So for those who don't know me, my name is Dr Ishii. I joined Dr. Cox in this practice about a year and a half ago or so. So maybe I'm not that new anymore, but you guys have just been so welcoming me with open arms to the practice. So thank you so much. And we will dive right in. So what is the PicoSure Pro? So it is a new laser device. It is something that we have been really, really excited to bring in, and it does 3 key things. It is actually very, very customizable. Number one, we can do something called pico toning. So pico toning is where we can improve overall skin rejuvenation, do a full field treatment of certain body areas, face, neck, chest, things like that. And we can kind of overall improve the skin quality, the skin tone, and texture of the whole area. We can also do spot treatments of pigmented lesions, so sunspots, freckles, things like that. And of course, it is a great laser for tattoo removal. So a lot of you guys who are pros that have been coming to us for a long time are probably scratching your head thinking, okay, well, why is Dr. Ishii even talking about this? Because I feel like you guys already have lasers to do all this. Well, that's a good point. And I want to explain to you why this is unique. So this is a more customizable laser that is actually one of the very few that's FDA cleared for the treatment of melasma. So as you guys know, melasma is a really, really tough condition to treat. And there's very few lasers that are actually really, really good at treating that. So we're really excited to bring this on. It is also the only laser that's FDA cleared for much more rare pigmented conditions, something like the nevus of Oda or Ito or Hori's nevi. So if you have any friends or family members that have been diagnosed with this condition, this is actually a laser that can really effectively treat that. And one thing that I'm really excited about is that this is a laser that is able to offer better and safer outcomes for my skin of color patients. And I'll go into a little bit more detail about why that might be. So a couple of kind of sciencey stuff. I know you guys come here to learn, so I want to teach you guys a little bit about why it makes PicoSure unique. So PicoSure, the name comes from picosecond. And picosecond lasers is really the amount of time. Picosecond is the amount of time that the laser delivers energy over. So when you actually look at that little table to the left-hand side at the top, you can see kind of like millisecond, microsecond, nanosecond, and picosecond. So our historic kind of pigment and tattoo removal devices have been in the nanosecond range, which is already really darn short. That's 10 to the negative 9 seconds. Picosecond, though, is actually 10 to the negative 12 seconds. So we're delivering energy over a shorter period of time. So in other words, we're kind of concentrating that energy so that we can better target the things that we're trying to get rid of. Another thing is that because you're targeting and because you're delivering energy over such a short period of time, if you look at this cartoon a little bit lower down, and I hope you guys can see my pointer here too, this is kind of the laser beam coming down to the surface of the skin here. And then you can see that we're able to actually create a true cavitation or a kind of a opening in the area that we're targeting, and that alone will help kind of break apart pigment and other things that we're trying to target. In addition to that, though, because we are concentrating that energy, you are actually creating these pressure waves. More technically, they're actually acoustic shock waves. And the reason why these shock waves are so important is because you're able to penetrate and affect deeper tissues. So you can kind of see that these pressure waves are going down into the deeper components of the skin. And because of these shock waves going deeper down, that's why we can do things like get fine lines, target acne scars, improve the skin quality, because we're able to affect and remodel some of that collagen that's deeper down into the skin. And the reason why this is really important is because we're relying on pressure waves and acoustic shock waves as opposed to heat alone, okay? Another thing that makes this technology really unique is this specialized handpiece. So if you look on the cartoon here to the left, it's called the diffractive lens array. And you can see that we're actually able to break apart a large beam of laser light into tiny little microbeams. So you're able to kind of sprinkle these microbeams throughout the face. And this is the handpiece that I would use to do the pico toning. So remember when we talked about kind of improving your overall skin quality, overall skin pigmentation, that background kind of sun damage, that is what I would be able to target with this diffractive lens array, okay? And finally, the reason why this laser is particularly unique is it is a safer treatment for my skin of color patients. Again, because we're able to concentrate that energy in a shorter period of time, we're able to better distinguish the pigment that we're trying to target versus the pigment of your natural skin. So we're able to spare the natural skin and therefore just concentrate on pigment or tattoo that we're trying to actually get rid of. Because again, we're relying on a lot of that shockwave energy more so than heat energy, you have a lot lower risk of post-inflammatory hyperpigmentation. So when we have more melanated skin, we have a higher risk of this post-inflammatory hyperpigmentation, and typically that risk is increased and exacerbated by heat. So by eliminating or at least largely decreasing the amount of heat we're introducing into the skin, we're able to decrease that risk as well. I want to talk a little bit more about tattoo removal because this is actually a superior tattoo removal laser, and we're really excited about that because, as we all know, tattoos are really historically difficult to fully get rid of. So I want to take a step back and talk about how tattoo removal actually works. So this is with both the PicoSure laser and something like the Q-switch Alexandrite laser, but the whole goal is that with lasers, we are actually breaking apart tattoo pigment into tiny little pieces. So when we fire the laser over the target tattoo, we're shattering that pigment into teeny tiny pieces, so it's easier for our body's own immune cells to actually come in, munch up the pigment, and take it off to our lymph nodes. That's how we get rid of tattoos. So I really like this, the pictograph that I have here at the bottom. This is a specialized microscope called the electron microscope, and they were able to actually take a look at what tattoo pigment does underneath the skin. So all the way to the left, you have untreated tissue. So just normal tattoo ink from a tattoo that was placed underneath the skin with no treatment. And you can see kind of the big globules of pigment. I like how they call them rocks. And then over to the middle, you see the Q-switched Alexandrite laser, which is actually a fantastic laser. And in fact, for certain populations and certain patients, I will actually still reach for this laser first. But you can see that with the treatment with the Q-switch laser, the rocks are now pebbles. You can see just how much smaller those particles are. But then look all the way to the right where the PicoSure Pro was used. Instead of pebbles, now you have dust. Those particles are so small, you can barely kind of make them out with your eye anymore, and they're just tiny little particles that's much easier for your body to clear out. And that's why picosecond laser or PicoSure Pro is a superior tattoo removal laser because you're able to break apart those particles into tinier pieces. I do want to introduce a new kind of tattoo removal solution that we're offering. It's called the Triple Fade FX Tattoo Treatment. We're really excited, and I'm really proud of that name because we and my marketing team actually came up with it, so go us. But this is a multimodal tattoo removal solution, particularly for your stubborn tattoos or tattoos that have plateaued after treatment with your more conventional lasers. I actually combined 3 different modalities, 2 of them being different hand pieces of the PicoSure laser, and then a third laser or a third hand piece, which is a CO2 laser. What I'm doing for this with this kind of solution is that we're targeting different layers of the pigment, different pigment colors, of course, but also with that CO2, I'm able to actually introduce columns of vaporized tissue on the surface of the skin. So not only are we getting our own body's immune system to munch up that pigment and take it off to our lymph nodes, we're also letting some of the pigment spit out from the surface of the skin. So especially for those tattoos that have been just so stubborn, not responding, or even have plateaued with our usual tattoo removal modalities, this is something special that I'm offering so we can really kickstart that process. All right. So what can you expect from a picosecond laser treatment? So first, when you come in for a consultation, I like to get your goals. Just because the PicoSure Pro is such an incredibly customizable laser, I want to make sure that we are targeting your goals to the fullest. So I'll talk about, okay, do we want to do spot treatment versus full face treatment? Which areas do you want to treat and which areas bother you most? What's your downtime? So for instance, if we were to do a spot treatment, of course, that's going to be a lot less downtime than if we did something like a full face treatment. I want to figure out your specific goals so I can customize this treatment for you. If we're talking about tattoos, I want to hear about other treatments that you've had in the past, how you've responded, if you've had a tattoo reaction, all these things I like to get and tease out during the consultation process so that I can customize the treatment for you. Now, I always want to remind you that PicoSure is always a series of treatments. So, in terms of how we space out that series, how many treatments in that series that it would take, I will kind of teach you that and coach you through that during the consultation process. On the treatment day, we do apply topical numbing to the areas that we're treating for about 30 to 45 minutes. We have you hang out in our relaxation pod so you can numb, bring a book, and get some work done. If we are treating certain tattoos in certain areas, I will use injectable numbing. And injectable numbing is almost immediate. So I do book you for a little bit of time, so I have time to numb the area, but then I can immediately start lasering. Okay. Once everything is numb, the treatment time will take anywhere between 20 to 30 minutes, depending on the areas that I'm treating and what I'm treating and the condition that I'm treating. And as always, we will apply your post-care for you and review the post-care so you're successful at taking care of your skin at home. In terms of the downtime, you're going to have a little bit of a sunburny sensation for about 30 minutes. You're going to be a little bit red and swollen for about 2 to 3 days. The first day is really when you're going to be the most red. You're going to then go through kind of like a sandpapery or almost like a flaky feel to the skin that will last about 5 days. If we treated pigment, that pigment is going to darken and turn into almost like coffee ground crust. And you guys might be familiar with that kind of downtime from other lasers that we've used in the past. And then that coffee grounds will kind of crust up. You'll keep the skincare on it. It'll kind of crust off in about 7 days or so. If we're treating tattoos, the tattoo area might bruise and blister temporarily. These are all kind of normal outcomes. And then, of course, anything that we use the body is going to take a little bit longer to heal than if we were to do just the face. Who cannot get this treatment? If you are someone that's taking a medication that increases sensitivity to light, recently or are on Accutane, have an active tan, or have keloids, I will typically do this on a case-by-case basis. Again, we'll talk about it at the consultation to make sure I can safely treat you. If you have a light-induced seizure disorder from like flashing lights or are pregnant, I do not treat. If you have an active or localized infection in the area or a skin condition in the area that we're trying to treat, I always like to make sure that that has fully resolved before we fire a laser on top of it. And if you have received gold therapy in the past, even if it was 30 years ago, I actually cannot treat. And that's, believe it or not, even though the skin looks normal, if I fire the laser over gold-treated skin, the skin will darken, and you're going to be sad, and I'm going to be sad. So I do not treat if you have had gold therapy in the past. And this is kind of a funny, unique one, but I have seen it. If your tattoo is a traumatic tattoo that's a result from like gunpowder or any other combustible element, I typically don't treat. And that's because I don't want to ignite that when I'm doing the procedure. So how can you prepare for optimal healing? Sometimes, depending on kind of the extent which I treat or kind of the body surface areas that I treat, I will have you take an antibiotic or an antiviral. If that is the case, I always ask that you take it just as prescribed. We always send you home with a handout on how to take care of your skin after the treatment. So I always say follow those directions. If there's any questions, just give us a call, text us, because I'd rather you call me and ask me questions rather than you're sitting at home wondering, oh man, am I doing it correctly? So we are always available. So always call us, text us if there's any questions. While the skin is healing, I do ask that you don't submerge in bodies of water. So that means like hot tubs, bathtubs, oceans, lakes, ponds, everything like that. I do ask that the skin is fully healed over, no more flaking, no more pink until you do any of those activities. And then no extensive sun exposure for 4 weeks before and 4 weeks after the procedure. And by extensive sun exposure, I mean I don't want you to have an active tan. So if you had a golf tournament and you were out all weekend and you have a very, your hat tan is very prominent, I can't treat you because, again, this is a pigment laser, right? So it's going to target that tan unnecessarily. And in terms of side effects and adverse effects, remember, swelling, that redness, that coffee ground crusting. If you have more thin skin, especially if we do some of those full face treatments, you might even bruise. This is all expected and normal. I do always want to avoid things like infection, hyperpigmentation, hypopigmentation, and scarring, which is why I will coach you through how to take care of your skin during the consultation process. And then I have tattoo reaction asterisks because some people will actually react to their tattoo removal laser. They'll get like hives to it or get a full body rash. If that's the case, it's typically an allergic reaction to the actual tattoo pigment itself, not the laser. So if you've had that reaction before with a different type of laser, let me know, because odds are that it will likely happen with the picosecond laser too. So we have to kind of figure out if it's worth treating or if it's not. And you got to protect your investment. So PicoSure, like I said, is extraordinarily customizable. So some people will do PicoSure as their main treatment and then do much lighter lasers like the Clear and Brilliant or the RF microneedling cool peel, things like that to kind of maintain their results. But also you can use PicoSure as maintenance of your other heavier lasers. So something like the Fraxel, the Halo, if you've done Rewind Time with me in the past. PicoSure is something that you can use as your maintenance for those treatments. So very customizable, a really versatile laser. And as always, I always give you a little bit of homework at home. I say I do all the heavy lifting for you here, but you have homework too with medical grade skincare to work on your results at home as well. So now we get to do the fun part here with the before and after photos. So this is a patient after 3 treatments. She is of Latina descent. She has tan skin at baseline, but she was bothered by kind of those sunspots over the face and just kind of the overall dullness and skin quality, skin texture. So with 3 treatments, she was able to get this amazing result. And you can tell here too that not only did we get rid of those individual kind of brown spots, you can tell that her skin quality, that skin luminosity is just so much better. And that's because she underwent that pico toning procedure with one of my colleagues and friends, Dr. Tangeti. This is a jaw-dropping result, in my opinion, but this is for acne scarring. This patient, you can tell, had kind of those like undulating textural changes, but also kind of the red and hyperpigmented spots there from prior acne. And after 2 treatments, you can tell that this is a really amazing result. And again, this is because we're able to introduce that shockwave, acoustic shockwave energy deeper into the skin for collagen remodeling. Now, 2 treatments I think is amazing. I usually say for acne scars, expect about a treatment of 5 sessions. But always, I'm happy when you're happy. So if you're happy after 2, me too. And this is that kind of more rare birthmark that I was telling you about, the nevus of Oda. So again, historically has been very difficult to treat, but now with this PicoSure technology, we can really make a difference in people's lives. And this patient has a little bit of a complex case because she has an overlap of melasma and sun damage. So with 8 treatments here, you can tell that she got a really, really nice result. Skin, again, overall looks brighter, of course the pigment is lighter, but I want you guys to focus on kind of her overall skin quality. This kind of line here is softer. Those kind of more ice pick kind of pores over the upper lip are shallower. So again, this laser can do a lot. It's not just working on pigment, it's doing stuff a little bit deeper too. And of course, tattoos. A multicolored butterfly tattoo. This patient said, you know what, I'm done with this. So after 6 treatments, it is almost gone. And even with really dense tattoos too, so a really nicely done professional tattoo, but with really dense pigment, you can tell after 2 treatments just how much of a dent they were able